it is my honor to introduce this panel as well. First, we have Cecilia Lapolli. I said your name right? Yes. I cleared it with Dani last night. So she is with Terra Health Coaching, and probably one of the only people here at this conference that speaks Portuguese other than me. So we are both fluent in Portuguese. Yes. How about that? It's rare nowadays. But she's also trilingual, so it's not just Portuguese. Dr. Patel, the CMO of My Private MD, he is a, correct me if I'm wrong, emergency medicine trained physician who then opened a DPC and now has many, many, many of them, has been very successful. Joseph Chamberlain, the CEO of Cornerstone Care Clinic, who is a pharmacist by trade, and then incorporated DPC, and there is a DPC out of his pharmacy right now as well. So those three are drinking the Kool-Aid. And then the one and only Dani Brown, who is the head of partnerships at Hint, and the proud mother of my 4 children. We have been married for almost 15 years now. DPC runs deep in our family. She supported us through, she got her MBA, okay, when I still had 3 years left of undergrad. She supported me through undergrad while I was playing basketball on long trips and a pre-med, and then through a master's program as well as and medical school and residency. We had 3 kids in medical school, 2 of which were twins. While we were developing an EMR, which is now the Hint clinical system, I would go work all day in the hospital and then come home and we would work all night. She is an incredible human, and it is my honor to introduce her as the spokesperson for this panel. So let's hear a loud standing ovation for our last talk of the day.
Wow, what an intro. Everyone should have their spouse intro them at some point. I, as the partnerships lead at Hint, am so happy to have heard many partners mentioned already today, and we're going to talk about 3 more. So I love, obviously, working with partners, helping practices grow, and these 3 folks up here are going to talk more about how they have worked with partners or are a partner, or the many different ways we're working with partners. So we're going to start with Cecilia. Cecilia. Oh, and I wanted to mention your question. I don't know your name, but your question about the pharmacy, we've got just the person to answer that question here. Cecilia, from Terra Health Coaching. Tell us how Terra is helping work with DPCs and piggybacking off of Travis's wonderful talk on adding new service lines. Tell us more.
Yeah, thank you so much, Dani. Well, we're really excited to be here, so thank you so much. I think instead of telling you exactly how we work and why we work, I'm going to paint the picture of a place called Enid, Oklahoma. Has anyone ever heard of Enid? Yeah. Okay, awesome. Dr. Bushman is out there, who we've been working with for the past 5 years. And I really love the community impact that he's had and our relationship with his DPC practice. Really, it started with Corey Bays, who we actually brought with us to Hint last year. One patient who came to us who was diabetic, really struggling with his weight. He was about 80 pounds overweight, struggling with alcohol use, and was really stuck in his health. But it really took working with the DPC that really believed in him and also in his patients, being able to take control of their health outside of the clinic walls as well. So fast forward 2 years later, Corey has lost 80 pounds. His business is thriving, and he's had an incredible impact on his immediate family, but also the community of Enid. And one might think that in Oklahoma it might be difficult to shift the culture around health just because of access and culture. But really, we proved a geographical and generational win in this case because Corey's family transformed as well. And this is all through the support of his amazing DPC and also working with a lifestyle medicine health coach. His son, Casey, lost 80 pounds as well before entering college. And his wife followed suit. So Corey's wife also lost 50 pounds in the process as well. So they're known in the neighborhoods for walking around for their morning walks, and they've been inspiring everyone around them. And as a family unit, they've lost 210 pounds without any weight loss medications. So this is just one example of how powerful one DPC thinking outside of the box, providing different types of resources for their patients, and it worked. So this is, I just wanted to paint the image of what that even looked like for Dr. Bushman. It was the same as a referral to any other specialist. If he needed to send a patient to a physical therapist, it's the exact same for a lifestyle medicine health coach. It's just a lifestyle prescription. So sends a fax, and then we contact the patient, get them set up with their coach, then they start the process, but there's absolutely no difference for Dr. Bushman. And that could be you in this situation in your community.
That's great. That's such a powerful story. I love that he was at Hint Summit last year, and had a lot of conversations too. A lot of really good conversations. Okay, so tell us more about how a DPC would add on Tara. How would that integrate into their practice, and like you said, create a referral? Yeah,
it's basically seamless. There's no added technology, no added hiring. You basically get an extension to your practice with just a referral. So, 70% of chronic illness is lifestyle related. We all know that. Habits really make a difference, and that can really make a difference for your patients. But, the DPCs we talk to really don't have the bandwidth or the time or the team to go follow each patient home and make sure that they're working and staying accountable to their new health changes, to stay accountable with nutrition changes. So that's where we bridge the gap. We want it to be as easy as possible, as seamless as possible, and absolutely no change in your workflow. So I love to highlight Dr. Jenny Labonte out at Inspire Family Medicine. She's in Massachusetts. We've also been working with her for the past 5 years, and she's included our GLP-1 combo therapy program into her membership. And she's had so much success with it that she's actually created multiple webinars explaining her smooth as silk referral process to include health coaching into her practice. And as a result, one of her patients actually describes herself as in Wonderland after a year on our programs and working with Dr. Labonte and her health coach. She's lost 80 pounds and can actually play physically outside with her kindergarten students for the first time in a decade. I mean, those are on-scale wins, off-scale wins. She's gained her life back, essentially. And one other patient is actually including herself in family photos for the first time since becoming a mother. It's huge for confidence. I mean, I'm in tears with these patients at the end of their program because it's really just incredible how the teamwork and the support from within the clinic and following the patient to their home and bridging that connection, it can be really powerful.
That's great. You mentioned kind of inside the clinic and impacting these families. How else do you see these partnerships kind of shaping the growth opportunities for DPC in the future?
Yeah, so, I mean, there are so many opportunities. We're actually working with different DPCs that are expanding into partnerships with employers. And actually last year here at Hint, we got connected with a brand new DPC just starting his own clinic. And he was wanting to really expand his connection to the community. He had a lot of African American patients, a lot of Spanish speakers, a lot of Middle Eastern patients. And he wanted to expand his reach, connect culturally with his patients as well, without hiring 1 million people to his team. So he embedded us into his partnership or into his membership, and a local employer caught wind of this, a veteran's home, and they decided to take on this provider's clinic to the employees. So they actually had access to a health coach and Dr. A's clinic. So they started the weight loss program. We joined it on a GLP-1 combo therapy program, and just 2 to 4 months in, we had a 25-pound weight loss per patient on average, and slashing cortisol levels in half. Patients were doing well at work and actually really thriving, feeling confident, feeling very supported. The employers saved money because the patients are not getting on the highest dosages of the medications and seeing better performance at work. And the provider's clinic got the recognition of having very quick results and having positive results. So what you could do going beyond the clinic is think about any area that your patients are really struggling with. It could be hormonal health or stress management. Bundle that into your membership, and we provide the lifestyle support. Pick 5 to 10 patients to start out with, and then go to a local employer and talk about chronic care management and cost savings, and that could be a really great place to start.
Yeah, that's great. One thing I do want to make sure we talk about is the thing I love that you guys are very conscious of is really having the people, the diversity for your coaches. Tell us more about that.
Yeah, that's been my passion project on the side as well. With the intro, you did hear that I speak Spanish and Portuguese. I've done a lot of my life living overseas, and that's something I'm very passionate about is travel and culture and languages. And we are so diverse in the US. This is the opportunity to really allow patients to feel connected to who they're working with, even if you don't physically look like them or don't speak the same language. We really wanted our coaching team, who's board certified, lifestyle medicine practitioners, but we want the diversity, we want the representation, because the patients need to feel safe. They may feel safer telling some really intimate information about the struggles of their professional life or home life with their coach, and that can really be a space to express themselves, and even in their own language. So I'm proud to say that at Terra we offer 8 different languages. All of our coaches are throughout the US, we're expanding internationally, and that really helps the DPC feel more supported with an addition to their team without having to hire people of many different ethnicities and backgrounds and languages. Just with one referral, you just have access to basically a whole extension to your team.
Awesome. Thanks so much, Cecilia. We're trying to pack as much good information as we can in the time that we have. So we're going to talk to Joey now. Joey is our resident physician, pharmacist. Sorry. Joey, tell us about your practice. Tell us the growth that you've seen with your practice at Cornerstone.
Yeah, so we got started in 2023. Toward the end of 2023, we actually launched following a hurricane. We were going to see basically our first responders and people that were coming into our community to help us. We just decided to treat them at no charge, just to kind of get started and start that process. But the main reason and why we started this thing was really access to care. We are in a county of about 50,000 people, and 10,000 of those people don't have access to health insurance. So they either don't get it through their work, they don't have Medicare, they don't have Medicaid. So really the big reason we started that was to help that population. Turns out a lot more people are interested in it than just that population. And things grew really, really quickly. We launched, like I said, in like September of 2023. By February, because I went back and looked at our numbers last night, in February of 2024, we were at over 200. So we had rapid growth, and then right after that, we actually transitioned away from one EHR over to Hint Clinical. And during that process was when we signed up for our partner, which I'll speak about today, which was SnapScale. So they do their virtual assistants, and we really needed somebody to help us with the process of transitioning all of the data from our old EHR into our new EHR. Some of that could be done, automatically, but a lot of it had to just be a manual process. So we brought that person on, Jason, who's our virtual assistant. We got him first try, so it only took like maybe 2 or 3 interviews for us to get hooked up with him. He did a great job getting us transitioned over to Hint Clinical, and then we decided to keep him on to do a lot of the administrative work. We still like having that direct contact with our patients, there in the clinic. So what we had him focus on instead were things like sending out those patient intake forms. Whenever we get messages through Spruce, which is another partner that we have, Spruce, any messages that come in through there that require the attention of the clinical staff, he goes ahead and creates tasks in our EHR so that they can address it in a timely manner, and there's accountability there. So we continued to develop and create more ways that he could help us out. We added on, so we do DOT physicals, things like this. He can actually go on and on behalf of the provider, put that information in on the FMCSA website as well. So there's lots of things. We probably haven't even scratched the surface of how that partner can help us. moving forward in our practice. So yeah, it's been a really good experience through that whole thing, and we're still learning how to maximize that.
Yeah, I think it's super interesting. I think virtual assistants are something that maybe some people are a little nervous about, right? It seems like kind of uncharted territory for your practice. You don't really know what you're getting. But is that true? How do you feel about that?
Well, so I understand the apprehension. The main thing for us was just start small. You know, if you don't feel comfortable right out of the gate, just have them do a small task, see how that goes, and then you can just continue to build on some of those tasks that you're giving them, and then as you continue to get busier, you're going to have more tasks that you're like, I don't really need to be the one doing that. Let's see if we can't have someone take care of that for us. Then all of our time can be focused on patient care, which is really where we want it to be focused anyway.
Yeah, I know Alexa from a previous talk mentioned virtual assistants, and then Alex talked about creating those SOPs, and that's really when it comes in, right? Being able to hand those tasks off that felt previously like you were the only one that could do them. It's not as scary as it seems, no. Right? So maybe you mentioned a bunch of things that they do, but maybe kind of tell people what are some things that you have virtual assistants doing for your practice that maybe aren't the first things that you thought of. How has that progressed?
Well, I don't know that people would think of, helping with the transition of an EHR. That was actually our initial job that we had him do. And, like I said, he did a great job. The DOT, putting that on the website, I don't know if anybody out there does DOTs, but it's kind of a hassle to log in and put those in. Once they get put in the chart, it's really easy for him to go in and do it because you can delegate that to another person. And so you just have to create a login on the website and then have him go in after you complete those to do them. But the other thing about SnapScale is make sure you find the right partner, because SnapScale does have some assurances as far as HIPAA, and they actually monitor all of the work sites and the workstations that these virtual assistants are at. So they're a dedicated healthcare virtual assistant company, and so they understand the importance of HIPAA, and so they've given us a lot of going into it. We felt very comfortable using them as our partner.
I think they'll appreciate you saying that.
Yeah, right.
So you are a successful entrepreneur who always has new kind of things in the works. Tell us kind of what you're thinking about is possibly next for your clinic. How do virtual assistants fit into that? Where are you going?
Well, virtual assistants are always going to be helpful in freeing up my time, our clinic staff's time to do more things, innovate. We're actually thinking about rolling out some new services here soon. Hormone therapy was one of those that we were considering, and that was just at the request of our patients. So we have a lot of patients who have issues with this, and they're not being taken care of in the way that they need to be. So let's see if we can't step into that area. IV therapy is another place to try to prevent ER visits. A simple saline drip can keep somebody out of the ER and keep them healthy. That's another thing. A lot of my time in the last year has been focused. When I came to this conference last year, I had many conversations with a lot of practices, and I think that there's a camaraderie between independent pharmacy and DPC. You're fiercely independent in DPC. We're fiercely independent in the independent pharmacy world, and it's tough out there, right? So one of the things that I tried to see if I could do was to actually find a way to connect DPCs to local independent pharmacies. So we created a service that actually will combine a drug program, like a drug plan that they can access nationwide at any independent pharmacy in the country, or over 65,000 of them. I don't know if it's all of them, but it's a very large number of independent pharmacies. And even at places like CVS, they just have to pay a small copay to access it through them. It also has a 24/7 urgent care telehealth, because we know your time at home is important. You want to protect that. And so a 24/7 urgent care telehealth helps your patients while, you have a holiday, or, your time off on the weekends. You can preserve that and then just follow up with them the next business day. So we try to create that, to create value for both in your membership and also to help preserve your time at home.
Nice. I like that. Hopefully that was helpful for that question. All right, moving on. Thank you, Joey. Moving on to Dr. Patel. Dr. Patel, tell us about how you got started in DPC and how you've grown.
So we started out in 2008, and stock market crashed just fall of 2008. So for 2 years, we didn't have a clinic. We were looking at options, and for many times we said, hey, is this the right idea? I mean, we were thinking about it for several years before we started. And we had our first clinic in 2010. We fast forward the clock 10 years, and we were at 30 clinics, and we had an exit in late 2019. So, during those 10-year period, it was a lot of trial and error, a lot of things that I can make a list of things that we did wrong. Probably it's a bigger list than all the things we did right. But we've learned a lot along the way. And really, our goal was one, and I believe everyone in this room, we have the same idea, is that we want to be autonomous from the rest of the system. But being autonomous in this area then becomes, you have this one clinic and you just sit on your own and run 300, 400, 500, 600 patients. But we really quickly understood that, hey, we got to reach out, we got to get the local we first went out to our local pharmacist in our town to say, hey, here's what we're doing, can you give us discount rates? And again, we started looking at options that we could embed into our clinic. So it was like, it evolved, Clinic 101, 102, onwards. And we never had a blueprint. We kind of went along the way, developed our blueprint. Every time we made a new clinic, we just modified. And at the end, I would say, if you could take your partners to your patients and say, this is part of our team, then you have a true partner. Right? I mean, because sometimes you may have a partner, but you hide them in the back. That's not the goal. You want to have them right there beside you. So you are maybe independent, maybe you have 1 or 2 staff, but having a pharmacist at your beck and call is amazing. If they're local in your community, they're going to respond for a unique need if it comes to be. So over time, we even started talking to the local radiology hospitals to see if we could get group rates, specific case rates for the hospitals. And a lot of it is evolution. It just kind of evolved as our customers felt, hey, maybe we can add this to our clinic. Until you grow it, until you get the right team and the right partners, there's going to be a time when you're going to say, this is now a medical home rather than a clinic. And that was our number one purpose, is that when can we call this our home? We built it our way. It's our medical home. We designed it the way we wanted it to. So when we look at these partnerships, I heard a couple of the lectures today, but the key thing again is there's a lot of options. Sometimes you don't even think about them until you come to an event like this. What Cecilia is doing is amazing. I never heard of that, but this is like phenomenal. And there's a lot more out there that you can essentially tap into when you need them, not necessarily have a full-fledged increase your HR in your clinic model.
Yeah, I mean, you could probably speak on behalf of many partnerships that you have done, but today specifically, we're going to talk about HealthBook Plus. So tell us why you were drawn to HealthBook Plus and kind of how you're using them.
So let me paint this. So how many of you are going back Monday to your practices? Next Monday morning, you're going to start seeing patients. Just imagine if you were in the exam room and you can walk in there and John Doe has a hemoglobin now, new lab came back and hemoglobin was 7.5. And normally it's like 14. So obviously you're concerned. You don't know what the trend's been. What if you could say, ask the medical records without even a keyboard in the room? Just ask, like you would ask Starbucks near me. Just ask, what was the hemoglobin 6 months ago? Because you want to know the trend. What was the hemoglobin 2 months ago? When was the last colonoscopy? Right? What was the results of the biopsy of the last colonoscopy? Literally, with a snap of a finger, this is just coming back to you with responses. And so basically you have somebody in the exam room that can essentially walk you through an entire past medical history, records, whatever the patient has that you have collected on that patient. Because just imagine trying to get the labs from 6 months ago, finding out who the colonoscopist was, what the biopsy was. I mean, it's literally, you're going to spend half an hour doing this, or someone in the office will. And if you can have an assistant in that room, it's like literally having a medical student or a student in the room sieving through this information on the spot. And so, you specifically said, why HealthBook Plus? And I think what I always said is that if I'm going to partner with somebody, I need to make sure that it fulfills a criteria. In my mind, I have a criteria, is that one, it has to save me time. And two, it has to be highly reliable workflow. And as Alex said, SOP, right? It has to be really highly reliable. Whatever that workflow is, there cannot be errors. Otherwise, if it's not accurate, then you got a product that works half the time, the other half doesn't. So I think, and then overall, it has to cut cost. It doesn't mean you're going to cut the membership fees, but in the system, I think it needs to cut cost. You need to realize what all has been done, so you're not repeating some of these tests and so forth. So the litmus test is that. So if you were to look at this patient and say, does it meet these criteria? If you were in that exam room on Monday and you were able to get this data with a snap of your finger, is it saving you time? Yeah. Is it highly reliable? Yes. And overall, you're probably doing really good for the patient care, that you're saving them healthcare costs, not repeating some of the things, and getting them care in a timely fashion, whether or not you may even want to know what the ejection fraction was, because his hemoglobin is 7.5. Maybe he's got some cardiac issues and it's high risk. You want to replace. So there's a lot of your decision tree is going to be based on data, and data is available. And HealthBook Plus is one of the folks that I kind of connected with some time back and recognized that this is where they are today. So, sometimes you feel like this is a sci-fi movie, but it really isn't. It's available today at your disposal. And my thought is, it's great patient care. Patient is really empowered because, the other thing is that who owns the medical records for your patients? You have an EMR. They probably went to a hospital. They went to an urgent care. They went to an ER. They went to a cardiologist. Everyone has their share of those records, and all the records are being held hostage, right? And so what if you were to empower the patient and bring all those records to the patient's phone? Patient owns it. If you think about who owns the medical records, remember in World Wars I and II, what do they do? The soldiers carry their records in their backpack. The patient owns the records, not the community hospitals and specialty surgical centers and whatnot. So HealthBook Plus allows that. The patient owns their records. The records are basically in their palm of their hands. And there's a lot of other features, of course, but this is something in my mind that was the first reason why I gravitated to them.
I love that, especially as your perspective as an ER doc, who gets maybe people coming in who, maybe can't explain their own records, and it's very powerful. HealthBook Plus, I just want to add here, also takes all those connected devices that we talked about in the Generations talk that we all wear, and takes in all that data and kind of aggregates the data and normalizes that data so that that's easily digestible by a physician or a clinician, and you don't have to sift through all these different things. So not only is it their medical records, but it's actually all of the wearables and all the connected devices that I think is really helpful. Sorry, what were you going to say?
Oh, absolutely. And I think what I tell the patient is just bring all your records in any format you have. And a lot of times, of course, they'll say, I went to this hospital, and we electronically, digitally can get those connected to a bridge. And, well, HealthBook Plus does in the back end. And sometimes the patient may have some handwritten stuff or old notes or an EKG or whatever that may be. I just tell them, put them in a shoebox. Give me anything you got, however you got it, just give it to us. And then keep in mind, this AI agent is actually going through all of this regardless of what sequence it's in, because now there's no shortage of data. I mean, if you say bring your medical records, they come with a stack this big. I mean, that's a lot of records to go through. If you throw it into this system, now you can ask exactly what you want. I mean, you literally get it on the spot, which, again, you don't have to worry about what page it's on, where is it old, is it new? It's all outlined black and white.
Perfect. Thank you. Okay, I mean, these are just 3 of our awesome partners that we have within our Hint ecosystem. We try to really partner with partners that are doing the best for DPC and really can add value to your practice. We do have, a couple minutes for if anyone has a question, but if you have partnership questions or you are a partner, I'd love to connect with you and kind of chat more. Yeah.
I've got a question on the health coaching. So
Great.
say it's streamlined. How are you compensated, and what are the patients having to pay? Is it part of the membership, or is it like an add-on to the membership? How does that work?
Is this on? Thank you. Yeah, that's a great question. So we can be looped into a DPC membership, and we have our fee per patient, $258 per month for 3 months. So they're looking at around $800 for the full 3-month experience. And then we have longer programs afterwards, like the GLP-1 combo therapy program, which has been the most popular, and that runs between $275 to $315 per month. And so we can be written into the DPC plan, or the patient can just go externally and work with us and pay directly. We're also HSA and FSA eligible as well. Yeah, thanks.
For Mr. Chamberlain, when you first started your DPC practice, was it exclusively DPC patients you were seeing as you ramped up?
Yes, so we started out as a DPC. That's what we were seeing primarily. We do a lot of employers as well, so we were picking up chunks in the beginning. So we picked up a couple of big employers. That's how we were able to ramp so quickly. But we were hoping at the end of this year to hit 600, and it looks like we're going to actually hit that goal, which is crazy to think about. We thought that was, just a crazy goal to try to shoot for, but it seems like what we're trying to accomplish in the community is resonating.
So I think, the conversation on pharmacy and primary care, I think, is a fantastic one. The one thing we've done is, in particular for vaccinations, where a lot of DPC docs, especially if you have patients who have insurance, that is where the independent pharmacies have been super helpful and flexible, where we're like, you know what, they carry them, go there, they'll bill your insurance, you won't have to pay anything. So that's been an avenue, I think, for a lot of those of us in DPC where we can't, we don't want to have them pay for their vaccine, so we say go to the pharmacy. Have you done much in terms of the vaccine side?
Yes, so we decided not to manage any vaccines through the clinic because we already do it there. In fact, we do travel vaccinations and consultations and have for years. So we're actually kind of in our community already known as the vaccine destination, right? So if there are these great companies out there that are right next door to your practice, like, use them. They're going to be a great resource for you. And I think there was a speaker last year that talked about the struggles of independent pharmacy. They're hurting right now. It's really tough in the pharmacy world, and they could really use support, especially from other independent, providers. So it's great. Thank you.
Okay, we've got a blinking red light up here. I think that means we're done. Thank you guys so much. Let's give these guys another round of applause.